Um, I'm going to switch and introduce Dr. Kwame Dance, who's our final speaker for the day. And I want to tell you just a little bit about Dr. Dance. He has been working on workforce development for more than 20 years, now that we're moving into 2024. Working with government agencies, community-based organizations, working with schools, and primarily trying to figure out how to help adolescents and young adults join the behavioral health workforce. In response to the high demand for mental health providers of color, Dr. Dance founded the Mental Health Advancement of Culturally Competent Education to Stop Stigma, the Access program, which is a culturally tailored mental health career pipeline expansion and mental health literacy program, providing paid internships for Black adolescents and transition-aged youth. Since 2019, Access has provided services and training to nearly 200 youth in Greater Boston and has received several awards and recognitions. In 2023, very happy to say that Dr. Dance co-developed and piloted the Massachusetts Department of Mental Health funded Building Bridges Toward Equity in Psychosis Intervention Careers, better known as To Be EPIC, that internship program for high school students and college students at the Beth Israel Deaconess Medical Center. So To Be EPIC is a career pipeline providing paid internships that aims to inspire Black and Latinx high school, college, and graduate students to pursue careers in early psychosis and in research. In addition to all of that, Dr. Dance is a community mental health clinical director and psychotherapist. He's an administrator and clinical coordinator in the Boston Public Schools and teaching faculty at William James, where he also earned his clinical PsyD with a concentration in child and family psychology and African and Caribbean mental health. So it's with great pleasure that we welcome Dr. Dance to talk to us about expanding and strengthening the mental health and early psychosis career pipeline for Black and Latinx youth.
Thank you so much. And let me get my slides situated. This has been such a wonderful experience today. Amazing work to everybody who's presented already. And as soon as I can share my screen, I will get it going. So thank you for the great introduction. And since you all have gone through so many of the wonderful, so much wonderful data on some of the disparities that these pipeline programs are aiming to address, I'm going to move a little quicker through the data so we could get out on time through the research, but I will move through it and make sure we cover everything. But we will be talking about the work that our wonderful young people in the Cambridge and Boston area have been doing with these pipeline programs. So my hopes for today are that we increase understanding of the value of early career pipeline programming, which we, again, have all seen the value of this as we've talked about some of these disparities that exist. So we'll hope that we increase that. We deepen an understanding for mental health disparities and the importance of cultural representation in mental health professions and increase awareness of the steps. I want to try to move us to that space because you've gotten a lot of other things. So this is me, little introduction. I found this important to, and I found this to be an important exercise for the young people in my programs, but also for us as mental health professionals, to identify ourselves as cultural beings and understand our identities and how we became who we are. So that's going to be a theme of this presentation. And two of these roles that I'm seeing on here, I'm going to come back to. I'd like to put a pin in mentor and mentee. So I was very fortunate. My mother worked for a behavioral health center, research center when I was a child. And I had exposure to some wonderful, now world-renowned psychologists and social workers and psychiatrists who were over here at Boston City Hospital at the time at an adjacent clinic. And I spent time with doctors like Olivia Moorhead Slaughter and Kermit Crawford and some others, if you're from the Boston area, that may ring a bell. When I was just a kid, that early exposure was absolutely critical to me narrowing down my professional interests from this smorgasbord of other things that I was exposed to. Some that stand out over here was athlete. I think I was not in my prime. I'm no longer in my prime for that, so that would have been a poor career decision. But but I was able to find myself to becoming a mental health professional. So getting into the role of mentorship and career exposure. The purpose of the Mental Health Access Program, Advancement of Culturally Competent Education to Stop Stigma, which we'll talk about in a second, and the To Be Epic program, is to show Black and Brown teens and college students what it takes to become a psychologist, psychiatrist, coach, social worker, a mental health professional, so that they can see themselves in the role and kind of know what it takes to get there. Hence why I became a mental health professional. I saw that I could. I saw people that looked like me who shared some sort of cultural identity or were doing the work and were in the communities that I came from. I knew I could do it, and I knew that because I was exposed to their stories. I was able to have personal relationships with mentors and be a mentee and eventually mentor others in a way that was accessible and was, allowed for space for me to be able to connect on a more intimate level with their profession and their personal journeys. So I eventually did. So this is the premise of social cognitive career theory, which is what these programs, along with, it's a systemic intervention as well, but in terms of theoretical models that were used to pull together these pipeline programs. Social cognitive career theory, which is somewhat what I just explained, as well as Bronfenbrenner's ecological systems model, and the part in the margin over here that's very, very important is an emphasis on culturally tailored work. That's the magic ingredient for getting these programs up and going and effective and getting young people to really engage and see themselves in the role. So just going to read these quotes, but first from Cambone. Worldviews evolve naturally through culture's survival and maintenance. The conflicting ideas of collectivist worldviews, such as African-centered worldview and individualistic Eurocentric origin and focus of traditional psychotherapy, is a barrier for Blacks, which can manifest as stigma. The other from White. Working within systems that conflict with the African-centered worldview, and being measured, judged, and prosecuted by standards that are not designed with African-centered worldview in mind, creates a perpetual and rational state of paranoia. So when we talk about how stigma lives and manifests and becomes a barrier to treatment and to seeking treatment and even feeling connected with Eurocentric or Western treatment and healing practices. This is where it stems from. It's, I think some may argue that it's a fundamental disalignment. So a lot of these disparities were covered in with much more recent data, which is wonderful. But just to mention a few that we know, there is no significance in prevalence of schizophrenia between Blacks and whites when SES is controlled. Still, Blacks are 4 to 5 times more likely to be diagnosed with schizophrenia than whites. Black males are more likely to be diagnosed with schizophrenia than major depressive disorder with psychosis or another affective disorder or traumatic disorder with psychosis as a symptom. And these highlight some of the disparities in misdiagnosis. Treatment disparities. Think we'll get into, I'm going to move through this quickly, but more Black and brown folks and people of color in general are more likely to receive older classes of medication, receive higher doses, be treated with antipsychotics, regardless of a diagnosis, even when possibly not appropriate, leave treatment prematurely, and report feeling disrespected in patient-provider experiences. I'm going to move through the slide to get to that. Some of the mediating factors at the patient level are greater mistrust, which is correlated to things like microaggressions and feeling that they are not agents. They have no agency in their treatment. And stigma, obviously. Patient-level factors to mental health disparity also include patient preferences, treatment refusal, compliance issues, biological differences, stigma, and disparities. So at the provider level, cultural differences may result in a higher likelihood of misdiagnosis, may increase the likelihood of misdiagnosis. And when needed, less than 20% of patients seeking mental health services have an interpreter services available. We're doing better than that. Thanks for our ASL interpreters. But these are some of the drivers for why the mental health access program was developed and eventually to be EPIC to try to mitigate these things early. So what do we get from that? Representation matters. One of the powerful contributing factors to mental health disparities is a limited number of racial and ethnic minority mental health professionals. So this is where we get into the purpose of what we did. So during the pandemic, we're still in the pandemic, but in 2020, 2021, I was working in a number of settings, in actually 2019 too, and one of which was Community Mental Health Center in Roxbury. And the demand for clinicians of color to work with our clients and clinicians in general, but there was a heightened demand for clinicians of color, and I was also the only Black male clinician there. It was so great. And people were really struggling. The majority of my caseload was individuals with psychotic disorders and bipolar mood disorders, personality disorders, et cetera, SMI. And because we were so backed up, we were seeing patients on 15-minute intervals for psychotherapy. We were calling it psychotherapy. It's really a Band-Aid, stabilization work, but that's all we could do. For the clinicians, it was extremely, for me, I burnt out. So one of the drivers for me for focusing on career development, pipeline expansion programs has been to mitigate that, to take pressure off of the few Black and Brown clinicians that we have, so that they can do better work, so we can see more people. I think for me, I realized that I wasn't necessarily doing my best work, and it was impossible to. And so in terms of systemic effort, this has become my passion to make a difference. So now we're into the process. So anytime that I'm developing any kind of youth program or program in general, a lot of you are probably familiar with logic models. So I just gave a little example, a template of a logic model, which I could share out. And I've actually used this with my young people. One of the 2021 cohort of the Access program in Boston, they put together program proposals for teen-led, youth-led mental health stigma reduction programs. So they use the same logic model. So they identified a problem, strategies, activities, outputs, short-term outcomes, long-term outcomes. And you see the example I gave, it can be taught to anybody. And eventually it looks something like this. So this is the logic model for the original mental health access program. So I'm just sharing that as an example. So the mental health access, the access program stands for the Advancement of Culturally Competent Education to Stop Stigma. It started in Cambridge in 2019, and actually in 2018, summer 2018, I ran a pilot program. It was part of a pilot to the pilot neighborhood service program, which was out of the Moses Youth Center in Central Square in Cambridge, Mass. And in that program, the students got to decide on a service program that they wanted to take on. So this was 14 and 15-year-old students. We had about 14 in that group. And they came up with a project that was the precursor to the mental health access program. And they did essentially a community needs assessment and presented that to city officials. So that was the start of the access program. In 2019, we ran the full pilot of the program itself, which I'll move into, which aimed to reduce community and individual mental health stigma, increase mental health knowledge, demystify mental health treatment by introducing participants to specific treatment modalities, exposure, which included trips to hospital settings. They went to zoomed into Bridgewater State Hospital to a seminar, went to Cedar seminar at Mass Mental. They went to William James College, Brandeis Counseling Center, Boston Medical Center. They've been to the young people that summer just visited a lot of places and ran workshops. They took their information. A big part of the model is taking the information and sharing it out with their community. So they took what they learned and taught their peers. Sorry. Access is a 6-week curriculum, the summer program. So Access is 20-hour a week, 6-week program. Students are paid for the Access program. They're paid through the City of Cambridge Mayor's Summer Youth and Employment Program in Boston PIC. So they are paid. Minimum wage has gone up quite a bit since I was a teenager, but they get paid well to go through this curriculum. A big part of the work is to not only create buy-in, but let these young people know that their careers and their interests are of value to us. It's respecting their identities, but we want to make sure any job program we're doing, we're paying, or any pipeline program, we're trying to find the funds and resources to pay, especially with Black and Brown kids. Oftentimes they have responsibilities outside of these extracurricular opportunities, and which can be a barrier to seeking out opportunities like these. So we pay them through the job programs. To Be Epic is slightly different. I'll get into that shortly. We use the culturally enriched curriculum that already existed, but it's gone through several modifications since the initial cohort. And mentioned the exposure. So the first cohort of access was 18 adolescents, and we were looking at preliminary efficacy and feasibility, and move through this, but you can see the demographic breakdown here. The chart on your right demonstrates the mix of mental health professionals, or depicts the mix of mental health professionals that we had come into Access that first summer. We try to keep the mix pretty similar. Even now, we've now run a cohort every summer since 2019, and we've run 4 school year cohorts of the Access program in Cambridge, the original program, and we've run 2 Access program cohorts now in the summer in Boston at in Grove Hall at Freedom House. Again, I mentioned change, agency, and advocacy, and being out in the community, sharing the information that is paramount to the stigma reduction component of this project. And both Access and To Be Epic, students have been able to put together and run workshops for large groups at their culminating events for their summer programs. It's kind of unique and an opportunity for them to build hard skills. I'll move fast. All right. So we didn't see what we found in 2019 is that there weren't any significant differences from pre to post in baseline mental health in the mental health knowledge areas or interest in pursuing mental health careers. What we found since then, that data stayed similar. Students, our youth have been exposed to mental health information, literature, media from a very young age, which was not the case when even a decade ago. And that heightened even through the pandemic. So we're seeing our students are coming in very, very high, close to the ceiling with their mental health knowledge and literacy, and their awareness of careers. However, that speaks to the importance of having an effective program and having strong individuals come and talk to them and build a personal connection between the work and their experience. So the initial cohort had some very positive views on mental health. All right, we're moving into the new exciting project, and Access is also exciting, but this is very exciting because we just ran it for the first year and it's a slightly different model. So To Be Epic is a career pipeline program that we had a smaller group. So the Access program was 18 to 25, 30 kids. To Be Epic serves 3 teams this summer. So 3 students, and they're working with us through the school year that are in high school. They came from Boston Public High Schools. 2 amazing college co-op students from Northeastern. We have support from 2 wonderful research assistants. We have a program manager who was a graduate student at a public health graduate student. They graduated, and we're very, very proud of our team, but what we wanted to do was model the pipeline and all. So this high school students were learning from the college students were learning from the graduate students and professionals in the space. And I'll move right along. So to be epic, I'm not going to show the video that's linked to this, but our students participated in weekly seminars on that built some skills around college readiness. So the high school students did a lot of college readiness work. They did workshop design and facilitation. They did projects. They all had an individual project where they worked with our program manager, and they were given direct support in developing and implementing their own research or creative projects. One was an interview, another was the precursor to a podcast, and another was a wonderful research paper. And they worked closely with them. They had a multicultural seminar, and that's in addition, and helped support some of the research studies in the office. They also spent 3 days out of the week at the Mental Health Access Program in Boston and in Cambridge, and hosted 2 mental health expos, which included all of the programs. So here are some of the key ingredients to highly effective pipeline programs, in my opinion. And again, I in a one of those past life things, jobs I had, I was a coordinator of the City of Cambridge mental health. The City of Cambridge Mayor Summer Youth Employment Program. So a long time supporting organizations and building these types of programs for young people, but having engaging and relatable staff. So the model for similar to Be Epic, but the model for the Access program was to get college students and recent graduates to be the ones who are leading the workshops. I'll chime in, but they kind of run the show with guidance. That's important because the youth have to see themselves in those individuals. So efficient recruitment and hiring, that's always difficult, but the more efficient we are, the better. So some of the other areas that I'll just pull out are make it fun. It has to be fun. Even though there's a pull to do a lot of work, 6 weeks in the summer, 7 weeks in the summer program is very short. It goes very quickly, especially if we want some sort of end product. But students need an opportunity to engage and interact and have fun with each other, as well as the folks who are coming in. Some of the others are having a loose structure, understanding that structure is necessary developmentally, especially for the adolescents, for the teens in these programs, but again, leaving space for them to be young people, and that includes the guest presenters who come in. I often instruct them just to if you want to bring slides, bring slides, but you could also just be very casual. And I think some of the more effective presenters that we've seen in both programs have been more casual and and a huge one at the end is being transparent and vulnerable about struggles and blind spots and biases, and that we make mistakes, and showing our young people that it's okay to make mistakes en route to their careers. So this is kind of a sample timeline of what it could look like to develop a program. So if you're looking to run a program beginning in July, when school's out, starting the program development, September to October is actually a little bit late. I think Michelle Freeman Yakubian and I started about a year prior to that, putting together the skeleton for this program. So we had about 2 years of work, but yeah, starting at least by then, starting an outreach project from October, November, around this time of year. So we want to be putting out job descriptions and reaching out to colleges because it gets competitive. People start to apply to internships around now. December to February, beginning the hiring process for your staff, for program staff. This wouldn't be the case for the high school students. Most of the summer job programs, as we found, don't start recruiting until March, April, May. And we found it beneficial to have an interview process. Things like scheduling can be really difficult, and technology can be really difficult for young people especially. So those are things that you need to just consider and build in time for, as well as getting back paperwork for onboarding. Those were some of our struggles, but we made it through. And thank you. I am going to try to pull up one of the videos while we're moving into Q&A, but I can stop the share for now.
Thank you. Thank you. Thank you. And I just want to acknowledge, I just put a note in the chat. I know some people may have to have a hard stop and leave at 12:30. We will be sending out an evaluation survey and welcome your thoughts about how we can continue these really important conversations together. But let's take a few minutes. Kwame, do you have a few minutes more to
Sure.
you us to answer some questions?
Absolutely.
Okay, so there's Vida, I think you were if you played Jeopardy, you would get to answer the question first. You're just like pop right on that button. So go for it, and I'll look at the chat and see what else is happening there.
Yeah, thanks. Hello, Dr. Dance.
Hello there.
But I wanted to, I guess this is partly for my benefit, but I also wanted to know, like, the youth that were from the co-op cycle from this year, what are they up to right now?
That is a great question that you would probably know the answer to better than me. But yeah, so they're working on research. They're working on they're putting together a wonderful video film project for To Be Epic that we're working with one of the directors. I'm a dean at Boston Arts Academy High School as well. So one of my colleagues here is going to be directing a film on psychosis awareness. And yeah, so the college co-op students are helping us put that project together, as well as their own research and presentations. They're doing some amazing work with their school, some awareness work and presentations at Northeastern. So, we're hoping to loop them back in with our high school students as well. Great question.
Any other questions for Dr. Dance?
I'll just chime in. I put this in the chat, and I think when I put it in, I thought the presentation was going somewhere else than where you took it. But it was really cool to hear about your project. First, nice to see you. I know Kwame from many years ago, so it's cool to see what you're working on. But maybe, and the question that I had put in the chat was, in the slide where you were talking about sort of disparities in diagnosis and how, the sort of like lack of diversity or representation in our mental health care providers sort of may be playing a role in that, which I think is for certainly like true. But I also I looked into it because it's something I think about, and I came across research that was showing that there's really no effect, but when there's a difference between racial and ethnic sort of difference between the patient and the provider. And I don't know, that just sort of I was surprised by that. And I was just, I don't know if you have any thoughts about it because the presentation was somewhere else, but if you did have any thoughts about it, I would be really curious, just knowing you, I would be really curious to hear if you have any thoughts about it, or what we can do. I think one, you're doing what you're working on it, which is great, but now what can we do now to sort of mitigate those effects?
First off, hi, Bernalyn. So good to see you. Yeah, so one thing that So I did my pre-doctoral internship, as Bernalyn knows, at the Center for Multicultural Training in Psychology. And one of the things we talked about is how we can improve, everybody can improve in terms of their cultural awareness, humility, just being cultural beings and being able to show up in the work authentically and curiously. So one factor that I think for white clinicians, as the numbers are not changing drastically very quickly, but is to make sure that you are educating yourselves on and constantly not seeing yourself as absent of culture, and understanding how disparities and biases can show up in any spaces, but understanding how those things can impact disparity in diagnoses and things like that. So the more informed and educated we get, I think that would just as a whole, I think is going to be helpful. Plus, folks are just in a lot of need right now. So I think the demand itself impacts the if you're getting any help, you're going to report that it's satisfactory when you're used to getting none. So I think there are a few factors. I'd be curious to hear what other folks think about why that may be the case, that folks are people might just be getting more comfortable talking to everybody. I think I know that study that you're talking about as well. I've seen it too, but there's a lot of it's an interesting discussion.
I think one of it is like, I don't know. I just think about like, maybe I'll connect with you after this too, because I'm really curious to hear more of your opinions. But just to highlight a point that you just made of like this idea of like racial colorblindness, and it's sort of like one thing that we can do. What I hear you saying is, like, don't pretend that like that the race is not in the room, or that like this isn't a thing that's present, but like acknowledging it.
Yeah.
Yeah, cool. Yeah,
Exactly.
thanks.
So I think, thank you, Kwame. And clearly we will want to continue having these conversations. We really appreciate your time and presentation. And I'm so excited to see the film product from the epic.
And with the slides, I'll send out some of the clips that I wasn't able to pull out. But just so you can see the kids doing the work and speaking.
That would be fabulous.
Yeah, we'll definitely post all of those online after. Thank you.
Great. Cool. Thank you.